Okay, so let me get this straight. The guy running Health and Human Services is sitting on $300 million Congress already appropriated for vaccines. Congress voted. The money exists. He's just not releasing it because of, and I'm quoting a sitting congresswoman here, unproven anti-vaccine beliefs. And that's just the first thing. There's a $5 billion Medicaid hole in Florida. Title X on the chopping block. Senior fall prevention getting cut. Rep. Lois Frankel had 5 minutes with RFK Jr. yesterday, and she used every second of it. Watch this, and I'll break it down after. If you're new, hit subscribe now.
Good afternoon. Thank you for being here. So you mentioned to Mr. Pocan that you agreed that when Congress appropriates money, that money should be released. So I want to talk to you about Gavi. Gavi is an organization that procures vaccines for use in developing countries, mainly in Africa, to help prevent deadly diseases, including malaria, measles, Ebola, yellow fever. Since 2000, Gavi has helped prevent nearly 20 million deaths, mostly children, and stopping deadly diseases before they spread. It's one of the most effective tools we've had to prevent outbreaks from reaching our shores. Now, Congress, in a different subcommittee, but with the full budget, we appropriated $300 million to Gavi, both in F-25 and F-26. None of this funding has been released, and we have told, the State Department has told us they're waiting for your approval at HHS to obligate these funds, and that you are holding up based on unproven anti-vaccine beliefs. So I want to just say this. I'm going to get into an argument with you, but these funds must be released immediately. It was a bipartisan appropriation, and we're trying to keep people alive and keep people healthy. That's number one. Number two, I want to go to a little different subject, which is Medicaid. In Florida, we have 4 million people on Medicaid. Half of them are children. And right now, Florida's hospitals receive standard Medicaid reimbursements at only 50% of the care. To close this gap, Florida uses the State-Directed Payment Program, which is a federal program, to secure additional federal funding for the hospitals. And they're providing essential services to our low-income populations. Florida is one of 3 states. We're one of 3 states whose state-directed payment programs have not been approved by CMS. And without approval, Florida is facing a $4.5 billion annual federal funding shortfall. This is not just a budget issue. It's an access to care issue. It's going to hospitals. Some will go out of service. Some will cut services. We are going to lose thousands of healthcare jobs, and patients are going to get sicker. This delay is unnecessary. It's dangerous, and I am requesting that you take a look at this and CMS act immediately to update to do this.
We are meeting every week with Florida officials to try to make this happen.
All right.
It's an $8 billion, so Florida gets more than any other state. It's a huge amount of money. And as you know, it's been used to game the system.
Well, okay, I don't want to get into arguments. I got some other things for you, but please take a look at it. We're a very big state with a lot of people.
We know that.
Who are
we're working.
Poor, and we did not expand Medicaid. Okay, I'm going to go to the next one.
We're working.
I want to just repeat something that you said. You said that these cuts now are to save children later. I'm telling you that your cuts, these children are not going to be around because of your cuts. I don't know who you're killing children to save children. One of your budget calls for the elimination of Title X, which serves 2.8 million low-income patients a year, provides basic care, birth control, cancer screening, STI testing, and infertility services. And eliminating this program would be a dangerous mistake. It means more undetected cancers, more unintended pregnancies, fewer preventive care options. And we've also been told that if you have the funds, you're going to divert them to clinics that do not provide evidence-based care and push anti-abortion narratives. This is going to make things worse. So Title X has been bipartisan. It's worked because it delivers real trusted care to people who need it the most. And I am just urging you to keep that in your budget. And my last 45 seconds, you also want to eliminate your fall prevention program. Falls is the #1 injury-related death for Americans over 65. 1 in 4 seniors, 14 million a year, experience a fall, leads to 3 million emergency room visits, 1 million hospitalizations, and a $50 billion cost to the healthcare system annually. Fall prevention programs work, and so it doesn't seem to me make any sense to cut those programs. And with that, 10-9-876-54321. Thank you for being here. I yield back.
All right, so let's talk about what you just watched, starting with Gavi, because this one is wild. Lawmakers are demanding answers after $300 million in congressionally appropriated funds for Gavi, the vaccine alliance, were allegedly withheld by the Department of Health and Human Services. Critics point to HHS leadership's historical skepticism regarding vaccines as the driving force behind the delay. And yeah, historical skepticism is a nice way of putting it. Pausing this funding endangers global health initiatives. Gavi is instrumental in providing life-saving immunizations against diseases like malaria, measles, and Ebola to developing nations. And this isn't some theoretical harm. Health experts estimate that withholding these funds could result in millions of preventable illnesses and severe outbreaks. Millions. That's the word they used. Prompting bipartisan concern over the administration's commitment to international disease prevention. Bipartisan, meaning even Republicans are uncomfortable with this. 1. And here's the thing most people miss. Kennedy already did this once. Last June, video address to the Gavi summit in Brussels, he announced the U.S. was pulling all future funding. Gates Foundation called it devastating. Doctors Without Borders called it cruel and reckless. Congress said, fine, we'll bypass you. Passed H.R. 7006, routed the money through the State Department. And now, he's blocking that too. The guy's job is not to decide which appropriations he personally agrees with. Then Florida. And I want you to actually read this one. A high-stakes standoff between Florida state officials and the Centers for Medicare and Medicaid Services is threatening to leave the state's healthcare system with a catastrophic $4-5 billion deficit. Catastrophic, their word. The dispute centers on a state-directed payment program intended to bridge the gap for hospitals that currently receive standard Medicaid reimbursements, covering only 50% of patient care costs. 50%. Hospitals eat the other half. While state officials argue the federal funds are crucial for keeping essential services operational for low-income populations, federal regulators have scrutinized the request, suggesting the state may be attempting to game the system. If an agreement isn't reached, healthcare advocates warn of imminent hospital closures, mass layoffs, and severely restricted access to care for Florida's most vulnerable residents. And Kennedy's response to Frankel in the clip, did you catch it? He said, Florida's been gaming the system. Okay, maybe. I don't know. But 4 million people are on that Medicaid program, and half of them are kids. You don't hold kids hostage while you argue about paperwork. You approve it, you investigate, and if there's fraud, you claw it back. That's how adults run a government. 2 other states are waiting on the same approval. Just 2. Florida is the 3rd, and somehow only Florida's getting the stall treatment. Kennedy said they meet weekly. Weekly meetings don't pay hospital bills. Hospitals are closing, jobs are gone, real care for real people. Meeting weekly about it is not the flex he thinks it is. Now, Title X, and this one I need you to sit with. A new budget proposal seeking to completely eliminate Title X funding has sparked outrage among healthcare providers and reproductive rights advocates. Completely eliminate. For decades, Title X has served as the only federal grant program dedicated solely to providing individuals with comprehensive family planning and related preventive health services, serving over 8 million low-income patients annually. 8 million people. The proposed cuts would strip funding from clinics that provide basic care, including birth control, cancer screenings, and STI testing. Opponents of the cuts argue that diverting these funds to clinics that do not provide evidence-based care will lead to an increase in undetected cancers and unintended pregnancies, fundamentally undermining public health and community safety nets. And Frankel looked him dead in the face and said, "You said these cuts now are to save children later. But these children aren't going to be around because of your cuts. You're killing children to save children. I mean, what do you even say to that?" He didn't have an answer. He doesn't have one, because there isn't one. Now, the senior one, which is honestly the one that breaks my brain, advocacy groups for the elderly are raising alarms over proposed federal budget cuts to fall prevention programs, a move they argue defies economic and medical logic. Defies logic. Their words, not mine. Falls currently stand as the #1 injury-related cause of death for Americans over the age of 65, with 1 in 4 seniors experiencing a serious fall each year. 1 in 4. Think about that. The economic toll of these injuries is staggering, costing the U.S. healthcare system approximately $50 billion annually, and resulting in over 3 million emergency room visits. Medical professionals warn that cutting these relatively low-cost preventative programs will ultimately result in a massive spike in Medicare spending and preventable hospitalizations in the near future. So, you're cutting a cheap program that prevents a $50 billion problem. That's not saving money. That's torching the house to save on the electric bill. This isn't a policy disagreement. It's enumerate. The math doesn't work. If you wanted to save money, you double the fall prevention budget, not cut it. So zoom out. The potential ripple effects of the proposed Health and Human Services budget cuts are sending shockwaves through the American healthcare workforce. From community health centers reliant on Title X to large state hospitals dependent on Medicaid gap funding, administrators are preparing for worst-case scenarios that include widespread service reductions and facility closures. Economists warn that if the billions of dollars in federal funding are not dispersed, the industry could see the loss of tens of thousands of healthcare jobs nationwide. Tens of thousands. This reduction in the workforce would inevitably compound existing staff shortages, leading to longer wait times, decreased quality of patient care, and an overwhelmed medical system unable to meet public demands. So here's the line. HHS is sitting on $300 million for vaccines, stalling $5 billion for Florida hospitals, eliminating Title X for 8 million patients, and cutting a $50 billion problem's cheapest solution. That's not one bad policy. That's a pattern. And the pattern is the guy at the top is running his agenda. Congress be damned. If this helped, hit like, subscribe, share it with someone who needs the full picture. I'll see you in the next one.